Thank you very much, Mr. Chairman. Director, thank you very much for being here. I really appreciate it. I first just want to express my sympathies. I know that we lost correctional officers to COVID. I see these as line of duty deaths. In fact, I did a wonderful bill with Chuck Grassley to make sure that law enforcement officers who die of COVID get the benefits for their families that they should. There's a presumption of it being a line of duty death. But I know that your job in normal times, the officers under your command, it's an incredibly difficult, challenging job that they put themselves at risk in service of safety. So I just want to express my gratitude and my sympathies for the loss, for the officers that were lost during this crisis. The risk assessment tool called Pattern that was designed under the First Step Act for good time credits. It's been used for home confinement and compassionate release during this pandemic. However, I've got serious concerns about the tool that we've expressed to your office because of the perception of bias that's built into the analysis. And it shows a sort of a stunning bias in terms of the number of African Americans versus number of whites who seem to qualify under that pattern tool. And so I'm wondering, will the BOP continue to use the risk assessment tool for purposes of home confinement and compassionate release for COVID-19?
Okay, thank you, Senator. Two things. First off, I mentioned this earlier, and I think it's important to point out, we did not develop Pattern. We assisted in the development through outside researchers and scientists, outside stakeholder input, and this tool showed across race, gender, and ethnicity, it had the highest level of predictivity, and that's why it was chosen. I did not choose it. We're the end user. It's the department's tool. It's being reassessed now. There were some adjustments made in January of 2020, Senator, to your point. There was a perceived or actual bias against people of color, so they removed two pieces of that. It was the age of first arrest and age of first of conviction and voluntary surrender. That was done to remove that bias or perceived bias, and it also created more transparency and fairness. Again, I did not select that tool. We are the end user, but it goes under review every year. There's independent researchers right now. The National Institute of Justice actually does the contracting for that. It's being assessed now, so I don't have anything to do with the assessment. We are the end user of that tool, so we will continue to use it as long as we're directed to use it.
So I know that you all are consulted, and the DOJ works with you as they develop and perfect that tool.
Yes.
So your continued engagement on its fairness is
our
really
staff were involved in it, Senator. The same thing with the needs assessment. We worked on the needs assessment with outside consultants, outside stakeholders, some of which were leadership of other correctional agencies, so that we get a good input of subject matter experts, and we developed the needs tool. We didn't develop it in a vacuum. We do get input from the outside. I was rather shocked at the IRC's report critiquing the tool when they had view of it and input of it also. So
well, again, it still seems to be imperfect, and I'm hoping that you guys have been very communicative with my office. I'm hoping you'll continue to take input with us as we try to get something that is ultimately fair and more fair and just.
I understand, Senator. Everything can always be improved, and we certainly understand that.
And I appreciate this dialogue has been really constructive. And can we get back to just the issue of solitary confinement in the age of COVID? For many months, we've been looking at the Fort Dix's COVID-19 numbers, and they were said to be low because of the BOP's action plan, and the agency was taking steps in that context. But we just believe that that is actually not the case, and that courts were buying the argument, but denying compassionate release that people should have gotten. And again, to give you an example, there's a man named Mr. Marlanda Trujillo, who was an individual incarcerated at Fort Dix, whose motion for compassionate release was denied. His underlying health conditions were pretty significant. Severe coronary heart disease, heart failure, chronic arterial fibrillation, severe mitral valve regurgitation. I'm trying to say these things like I'm a doctor, but I'm not. Multivessel coronary artery disease, chronic diastolic heart failure, and more. Mr. Trujillo was later put into quarantine because of his risk of contracting COVID-19, but Fort Dix's quarantine process appears to have spread rather than contained the virus. And tragically, Mr. Trujillo died. And so this is to me a matter of not just justice, but it's a matter of compassion and empathy to keep people that are so frail in their condition, their risk to the population is so low. And so I just want to continue to be engaged with you on these concerns. We know in New Jersey, the virus, unfortunately, is still stubbornly persistent. And I'd like to just maybe end with just the question, what steps are you trying to take to continue to ensure that CDC guidance is being used to prevent more unnecessary deaths and not putting people in solitary confinement, but really trying to lean into the idea of that word compassion, and as in compassionate release. And I know that this is, we need to move on to my colleagues, but I'm hoping that you can give me a brief answer now, but maybe we can continue to have dialogue between my office and yours.
Absolutely, Senator. Two things I want to clarify for you. I appreciate the opportunity. Number one, I can't necessarily talk about certain cases, but I will tell you in a case such as the one you described, the compassionate part of all that is the emotion. And I certainly understand all of those deaths weigh on me. If we did not recommend that individual, there was a very good reason. I'll give you an example. They may have had a detainer or something of that nature, which is hard criteria. So I have to follow the rules, Senator. So sometimes people don't understand. We're not letting someone out because we don't want to or don't support it. We're following the rules as given to us. So I appreciate the ability to clear that up. Fort Dix, I oversaw Fort Dix as a regional director. As you are well aware, at one point there was over 5,000 inmates here. It was the single largest facility in our agency, one facility, two separate east and west. It's down about 50% capacity. I did that based on my working knowledge of that place. Our goal is to get it down because of the points you said. We learned early on that you can't social distance in an area like that, open barracks. So that's one of the things we did. The other thing I'll point out is from day one, we get much criticism about how we responded to COVID, but we have been in lockstep with CDC guidance all along. And when it changes, it's difficult for us in a correctional environment sometimes to apply that guidance, but we do our best to do it. Our medical director of the agency speaks to CDC on a weekly basis, sometimes daily basis. So I want to stress that to you, that everything we do is in lockstep with CDC. In fact, we had input on the guidance that CDC put out for correctional and detention centers. A lot of that came with our collaborative efforts with them. So I don't want anyone to think that we're making this stuff up as we go along. We are consulting with the experts out there and making adjustments. It's very hard to apply sometimes in a correctional environment because security and safety is always going to be first and foremost of everything. So thank you for allowing me to answer that.
No, sir. And again, the communication is really critical, and I appreciate that you having those open lines,
Yes, sir.
open channels. Thank you.